Hello and welcome to this special broadcast, a discussion that puts the spotlight on what matters the most, your health and well-being. I'm Molly Kampir, and today we are focusing on an issue that affects us all, knee health. After all, knee injuries are a rapidly growing health concern in India. Why is that? What can you do to protect yourself? What are the do's and don'ts? Look no further, we've got you covered. And with us today are two very special guests. Dr. Prateek Kumar Gupta, Vice Chairperson, Department of Orthopedics and Head of Sports Medicine Unit at the Sir Ganga Ram Hospital, Delhi. Thanks very much for being here and sharing your time. And we are looking forward to having a very insightful conversation on the many issues revolving around what we just highlighted. But Dr. Gupta, if I can begin by asking you to just tell our viewers more about what really are the immediate telltale signs for a person that something might be wrong with my knees. What are the signs to really watch out for?
So if anybody feels that the knee is not feeling normal, there is commonest thing is to have pain, difficulty in walking, sometimes clicking sounds, swelling, which is persistent. So sometimes we have pain 1 or 2 days because of minor strain that you can ignore. But if the things are persisting, these symptoms are persisting beyond, let's say, 4 or 5.
What can one do, Dr. Gupta, to really safeguard our knee health and something that can be incorporated into one's day-to-day life when it comes to really marrying those aspects with what is doable in a work situation? Because a lot of people talk about how physical movement might not be possible.
Yeah. So we are looking at the preventive aspect, what we could do to prevent. So the commonest thing is to maintain your body. So conditioning of body is most important. So try avoiding being overweight, which we all are aware. Regular conditioning of the muscles. So muscle strengthening is very important. So if you have a good conditioned body, you are likely to less suffer from injuries and save yourself. The other thing is, if you are doing certain physical activity, as Dr. Deepak said, that the physical activities in India have increased and now more and more people want to be active, whether it be whatever age, and you are involved, so follow the rules of the game so that you don't have injuries. So the commonest is to have a good warm-up. So give yourself 5 minutes before you start doing any physical activity, stretch out, get the circulation good. Secondly, follow the proper gear. So if you are going to walk or you're going to play, have proper shoes, proper gear so that your knee is not put at a disadvantageous position. Third is maintain the body alignment. So do the things in a proper fashion so that you are not prone to injuries. So those are the few things that you should do, and then obviously there are certain things that you can avoid in your day-to-day activity, certain postures, certain things which make your knee prone, like too much of kneeling, sitting cross-legged, squatting, and things where you could sustain twisting injuries. So avoid being in that position. So those are the things.
Dr. Gupta, I just want to ask you, how exactly does a meniscal tear really compare with the other types of knee injuries? Because that's something that also needs to be understood.
Yeah, so meniscus injury is one of the commonest injuries because most of the ligament injuries, up to 70-80%, are associated with, along with meniscus injury. Also, meniscus injury happen in isolation. When you have twisting injury, you may or may not have a ligament injury, but you could have a meniscus injury. And the other ways of having meniscus involvement is in arthritis and other condition. So if I were to say that is the commonest injury of the knee, to have a meniscal injury, meniscal tear. So that is the common.
Right, and since you helped us with that model to just understand the knee functioning better, how exactly does the meniscus play such a huge role in knee functioning? If you can just elaborate on that.
The meniscus?
Yes.
The meniscus is, as we said, is a cushion in between the two hard bones, which are not conforming to each other. The thigh bone is round while the shin bone is flat. And this is an interface which actually transmits the load from one bone to the other. So it distributes the load equally so that there is no particular wear and tear in one position. It also works like a shock absorber. When we jump, run, the bones do not hit each other. There is a meniscus in between, which is like a sponge, like a shock absorber. Third thing it does is gives stability. So it performs like a concavity where the bones are stuck to each other and they don't move away. Other thing it does is nutrition. So every time the knee moves, it squeezes out little fluid from the meniscus, which works like lubricant as well as a nutrition.
Are some people more prone to getting such kind of injuries? What kind of sports activities really contribute to meniscal tears?
So any sports where there's sudden abrupt movement or a jerk can expose you to meniscal tears and soft tissue injuries.
Like the term knee-jerk reaction, wahin se aaya hai.
Yeah, so like that. So contact sports are the commonest, and if you look at Indian settings, so the sports which we do locally in India, like kabaddi, wrestling, cricket, are the commonest. But if we look at our practice, and I'm sure Dr. Deepak would also agree with that, we find football is the most common sport that we get the most patients coming with after meniscal injuries. So contact sports, the next is basketball. So jump and land is the commonest time when they actually twist the knee and result in a meniscal tear, and if persists or severe, then it can be a ligament tear also.
Right. So when we talk about meniscus injuries per se, how and can they be mistaken for other knee problems at the early stage, and how exactly does the differentiation happen?
So yes, the meniscus injury can be actually misleading and to soft tissue injuries, sometimes ligament injuries, because sometimes they also present the same way, like instability. Ligaments also present with instability. If it's a flap tear of meniscus, it gets caught between the bones and gives you a feeling of instability, which is primarily in ligament, but you can have it in meniscus also. So you may be misled to have thoughts of other injuries. Right. And the differentiation goes with a proper clinical history, where the history should suggest a twisting injury in a particular format, and the patient complains of pain and more like click, catching sensation, locking, as Dr. Deepak said. Those are the symptoms which suggest that there is a possibility of meniscus injury. And then comes the physical exam. So there is a particular line where the meniscus attaches in the knee joint. So as was shown earlier, so if you look at the knee from the front, which is like this, on either side, here and here is the meniscus. So when you are tapping on the knee joint and on the same aspects where the meniscus attached, and if the patient has pain, then you suspect that there is a meniscal tear. Right. And then there are physical tests where basically physically you grind the shin bone against the thigh bone, and the meniscus being in between, that moves with it, and if any part is torn, will not move with the shin bone and will get caught and will cause either pain or clicking, which is again a confirmatory sign that is actually a meniscal that we are dealing with. And obviously in the end, MRI can show you everything else.
Sure. Perhaps one question that many would have is, can a meniscal tear repair without surgery, Dr. Gupta?
Yeah. Not all meniscus injuries need surgical intervention. Right. Certain meniscus, but there are a particular group where it's a minor tear, which is a small tear less than 5 to 7 millimeters, and also location of the tear is very important.
The location of the meniscal tear.
Yeah. So where in the meniscus is the tear located? Right. So if it is towards the peripheral part of the meniscus, where there is a lot of blood supply, so there are good blood supply, so good signs, a good area where it can heal. But if it is towards the central part, where the meniscus is thin in structure and its blood supply is poor, then that meniscus is less likely to heal. Yeah. So if we have a small tear, we have it, what we call as red on red, means a lot of blood there, blood supply, which is on the peripheral side. And third is if the stable knee, if they don't have any ligament injuries or other things, which will keep pushing the meniscus every time, then meniscus gets time to heal. So those are the 3 or 4 conditions where if you leave the meniscus as it is and give initially some rest, ice and immobilization followed by rehab, they're likely to heal. But if any of these things are not there, if the tear is big, if it is not on red, means red side, or if there is ligament injury associated which will keep disturbing the meniscus, then non-operative treatment, which is the conservative treatment, is less likely to get the desired result, and there meniscus repair. And with the improvement, as Dr. Deepak said, with the technology now, we have got such good meniscal repair systems and instruments which are very thin and very sleek. They do not cause any damage to the surrounding structure, because very important, like if you're doing the meniscal repair, you don't damage the other structures of the knee, which then later on cause problems. So their instruments are so sleek and so good that you can do the repair without disturbing and causing other parts injury to give us good results.
Very important, and for a sports person to be away from what they do, obviously, is is an emotional period as well. So like you're saying, the recovery is smooth and it doesn't take that long, given that the precautions are observed. And physiotherapy is a very important part of that recovery process. So tell us more about the role that that plays, and how important is adherence, because like Dr. Chaudhary also said, commitment from the patient to follow these protocols is also important.
So physio is very important because I say 50% is surgery and 50% is physio in the result which comes at the end of the day to the patient. So it actually starts moving the knee quickly, which is more important, because the moment you restore the function of the knee, movement of the knee, everything, the blood supply, the movements of the muscles, they come out to normal and you start recovering quickly. And it is commitment for at least 3 to 4 months, and recovery period, depending what we take as recovery, normal walking is 4 to 6 weeks, gentle jogging is 3 months, running is about 6 months, and back to sports anytime around 6 months. So whole process of this rehab is under physiotherapy, and it's very important to gain the function, strength, and then finally returnability to the sports by specific test, certain level of fitness achieved, certain level of functions achieved by the knee, which is assessed by the physio and then by the consultant.
Very important, Dr. Gupta, if I can also ask you to outline, this whole concern of, can I be fully back in my form after surgery? So like Dr. Chaudhary also is saying, it's a very important part of the understanding with the patient.
Yeah. So one of the myths, as Dr. Chaudhary also said, another myth is that once a ligament injury or once a meniscal injury, it will never heal. Or most of the time people think of surgery is not the best option. All these injuries should be treated non-operatively, which is wrong, because there are certain groups which we highlighted which will respond to non-operative, but the other ones would do very well with surgery. And once you have surgery, then you are confident about the movement and that you have repaired it. So as a result, if you work properly with the physio, you can achieve the stability, and which is tested regularly. And so you will be able to get back to your level of sports only with the combination of a surgery as well as rehab. Obviously, leaving aside the small bits which are small group which will be treated non-operatively, but treatment and rehab combination takes you back to your sports. And there are so many examples of people who have had meniscal repairs or meniscal surgeries and have gone back to doing their full sports without any.
And knee, of course, is the lifeline, and like you're saying, it's about the overall health and well-being. Jaan hai to jaan hai, health is wealth. If you can also, Dr. Gupta, just tell us more about this whole aspect of eating supplements. Do they work? How much should be taken? Is it a gender-based decision as well when it comes to calcium intake? So if you can just outline for our viewers the do's and don'ts when it comes to the overall knee health, and just whether or not supplements, to what extent, are a good idea.
Molly, this is another big myth which we would like to put on air today, is we all have this, that if we take lots of supplements, we will become Arnold or we will become Virat Kohli, or we'll become. It is not the case. See, what is important is workout, conditioning, and what you are working in gym and activity and your physical training, which is most important. Now, an average Indian sports person does not do more than 4 or 5 hours of workout in a day. And the statistics have shown that if you take a normal diet, which is properly proportionated, proteins and all that, minerals, you actually do not need any supplements. If you work out more than 4 or 5 hours, like Michael Phelps used to do 8 hours, so that's when the supplements are really going to help. Otherwise, lots of proteins, lots of amino acids, lots of supplements are being used, which gives us mental satisfaction that we are putting in things. So what is important is to do good workout, and obviously certain time of the life, gender, again, there is no difference in the gender as for the age group is concerned. But if we are on the higher side of the age group, near the menopause or having hormonal issues, so that's when the calcium in females may be required more than males. But as a sports person in a sports life, normal life, you do not need any.
Prateek,
So it has to be individualized. So one has to understand their own body. What part of life are they? Are we young? Are we middle age? Are we in 60s? So you have to tailor it, and you have to do what your aim is. You have to have your own goal. And as Dr. Chaudhary said, you have to make it slowly. So a lot of time when you go to the gym, they push you both the intensity wise and the training wise. So you take it and you listen to your body always. If your body is reacting or the body is showing signs of fatigue or problems, then you need to look at, what am I doing? Should I be changing it? And always be aware that you should be doing whatever you're doing correctly. And you should have a trainer or somebody guiding you. Until unless you're doing just very basic, that is different. But it has to be tailored to individuals' age and capacity, and sometimes also looking at the medical conditions. Many people have arthritis or some cardiac conditions, so they can do certain kind of workouts and certain type of physical activities they can do. So that is important to know.
Thank you very much for that insightful interaction. I'm sure it answers so many questions that our viewers would have, and it also helps them decide what's good for them, what's not, and raise awareness overall about the options that are out there when it comes to knee injuries and what kind of knee injuries and overall knee health measures that need to be taken. Thank you very much, Dr. Gupta, for your time. Thank you.
Thank you.